Hello guys, how are you? This is 3 weeks post-op. Well, actually it's 23 days after double jaw surgery. This video has been impossible to record, so I hope I don't forget anything, because anytime I record it, something happens. That's why this is 23 days after the surgery and not 21 days exact. Also because I went to my orthodontist 2 days ago in Madrid. She told me, by the way, that everything is going very good, that to chill down a little bit, because I was like, but yeah, I have like a funny face now and my smile is very unnatural and all the normal things. And she was like, I see it very well. You don't have now like the incompetence, the labial incompetence that I used to have when I was closing my mouth. Now I just close it very naturally, and now with the wrinkles and the forced face I used to have, like very highlighting a lot my chin as well. So yes, she also told me that the occlusion is going good. You can see maybe it's moving a little bit, the teeth, because I don't have anything at the moment. No Invisalign, no braces yet. Just before the surgery, they told me take out the Invisalign, and I asked the surgeon, and when am I going to be able to have my Invisalign back? And he was like, maybe 2-3 weeks later, but I think it's not gonna fit because I'm moving your jaw around, so you're going to have to go back to your orthodontist. And the fear I had, that I couldn't open my mouth enough in order to have it scanned, it confirmed. My orthodontist was like, yes, I cannot put the scanner inside in order to order the new set or the new batch of Invisalign or aligners. So just come back in a month after you go to Barcelona again to see your surgeon, and then we will scan it then and resume with our orthodontic treatment. So it's gonna be 1 month still, in order to, no, more than 1 month, like almost 2 months without anything in my mouth, no braces, nothing. But she was like, no worries, because also as they put the bone graft in between, when they did the double jaw surgery, they realized that after the expansion we did after the sharp surgery, the bone didn't close and healed totally. So the surgeon had to cut some bone and put it in between. So now it is stopping it from closing, from moving, and it has more of a solid position now. So my orthodontist told me, like, we can be a little bit chill because this is not gonna move. Also, yeah, I asked her, and sometimes I hear some sounds and feel some movement. I don't know if this is the plates, the teeth, and she calmed me down a little bit, like saying, first of all, the plates, they are fixed like with very good screws, and this is very solid, so this is not gonna move like whatever. And also the teeth, this is normal that you can hear some sounds because of the swelling, the gums. There have been a lot of movement in my teeth lately, so there's a little bit of a space, so it's normal that you can feel that it moves slightly, and even it sounds, but it's totally normal, so nothing to worry about. Just keep doing like the cleaning like very well, and it will be fine. Actually, she told me that my gums were very good, very, very pink, and so this means that we have been doing a very good job with it. Now I'm just using normal brush, normal toothpaste, and also the normal liquid, just for using it for having your mouth fresh and clean. So just it, not chlorhexidine. We stopped after 10-15 days. I stopped because it can get your teeth yellow and with stains, so it's better to stop right after the 10 days. Also, I saw my first stitch that came out. I was brushing my mouth like very well, and I was going a little bit up because I wanted to have my gums like very clean. And suddenly I was like, what is this? And I took the stitch out, and no pain at all. And I asked my nurse if it was fine and it was a normal tempo, and she was like, yes, from the second week the stitches will start to come out, but no worries. It is important that for the first and second week we don't take any orange juice, Coke, or acid drinks, because it can affect the pH or of the the skin or the stitches to come out faster. So we don't want this. They have to be there for the time they have to. So yes, and after that you can resume with this kind of drinks. Yes, you can drink coffee, because this is something I stopped. And she was like, yeah, you can, it's fine. And actually it's helping me a lot because I have low pressure and my energies are very low after the surgery. It happened the same to me after the surgery. So yeah, it's good. And more things, I'm gonna show you my swelling. It came a little bit more down. My nose, I think it came down a little bit as my swelling is going down as well, but it is still a little bit different, a little bit more pointed up, but I think it's cute, it's fine. The way I see myself, this is like carousel, or I don't know how you say that, but there are moments in which you see, and also my family tend to tell me all the time, like, you look funny now. And it's like, I don't want to look funny. I just want to look me and normal and good. But also my orthodontist told me, like, your family, they have to get used the same as you have to your new face. You made yourself your entire life. You've seen yourself in a way, and now you and your family have to get used to, and your friends. But the people who met you for the first time, they're gonna see you just fine. Of course, you have to wait for 2-3 months until you look more natural, like your expression and everything comes a little bit more normal. But yes, it's a matter of waiting. There are moments, as I heard to many other patients, that you think, wow, I'm gonna be worse now than I was before. But later you can see some of the comparisons I posted on my Instagram, like a good stone lower bar jaw surgery, in which you can see the before and after of some of my mouth, or of my expression, or my longer face a little bit. So, and then I see that and I am like, no, we are going ahead. This is improving. This is gonna help me. And also, to be fair, I saw a couple of friends with no makeup at all, or early in the morning, and before I was feeling like not confident, because with this long face syndrome and the bone behind and all of that, I looked a little bit more with my flatter face and like sick or skinnier. And now, because it helps the swelling, but also because it as the two jaws went forward, it gave a little bit of more support to my soft tissues, and now it's a little bit shorter, my face as well. So in general terms, it makes me look more like healthier and rested as well. Also, it helps the fact that now I sleep better, I breathe better, and also I read that when you're a buccal breather, you have a worse color of skin, because you don't, you have some lack of oxygen. And now I even could tell that my skin color is a little bit more like healthier. So in conclusion, when I saw some friends with no makeup early morning, I felt more confident with myself. I didn't feel like, so self-conscious, and this is like awesome. So even though there are moments I doubt and I hesitate of the final result, but I have the hope that, okay, you just have to keep going. This is something you have to bear really in mind. This is the satisfaction curve of all the patients. First month, you're not gonna be happy, not the second. The third, maybe you start to be a little bit more happier, but until the first year is when the highest rates of good or satisfaction arrives for most of the patients. So it's a matter of waiting a little bit as well. So yes, this is, and also with my mental health, it helped a little bit the fact that I started to socialize a little bit, and actually one very close friend, he told me, don't get too crazy about it. Like, of course, first time maybe I saw you, I looked more at your face, I was knowing you, but now it's more about the person you are than I don't care. And I was like, yeah, that's good, thanks. So it helped me a little bit, and to get your head on other things, not thinking that much, because when you are in this process, you get so fucking picky. You look at every single detail, like, oh, now my lip is not going there, oh, this is not symmetric now, this is actually, for example, one thing I thought is like, oh, now I have to make up myself different, because before I was making like here, like to make it look rounder, but now maybe I can do like silly things like that. So yes, just try to not have this on the center of your life. Of course, you have to really take care of yourself, but try to do all the things, go out with your friends, and just have mental peace on that. And more things about my skin, I noticed, I had a lot of peeling. I told you that I had very dry skin before, and when I started to put some makeup on, and then I was noticing that my skin was rubbing off, like falling. So because of the dryness I had, so very bad. But now I'm starting to have some greasy areas, like here, and pimples. And I also heard that some of the patients then they had like very lot of pimples after the surgery. So I hope I don't have many more, but yes, I had a little bit of it. Also the scar that I had after this surgery, when they were opening my mouth during the surgery, they burned a little bit, like here, or cut it, or I don't know. So I'm using also, I told you about Rosa de Mosqueta oil, essential oil, that is very good for the scarf. But also I'm using this is Stila cream or moisturizer. This is actually for the eyes. When you have a surgery in your eye, it was from my father, but I asked in the pharmacy, and this is very good for the stitches, like to not have any mark in the end. So I'm using it, and I think this helping a little bit. I hope this goes away, because it would be good to not have it. But anyway, I have to use it more consistently. And what else? I think that's all. I have my some things I wrote. Also, I wanted to tell you in this video some of the questions, talk about some of the questions that you had, and also the questions that I had before the surgery, for my orthodontist, for the nurses, for before and after the surgery. And I thought this is very interesting to share with you, because I think we share all of these questions. We are all over the place thinking all the time, like, oh, and what about this and this, and when will I be able to come back to work? By the way, I didn't come back to work still, because sometimes I after I speak a lot, I have ear pain as well, and this like a little bit stiff and some cramps. Like when I speak suddenly, I have like, oh, it comes here like a little bit of pain suddenly, and I shout at this moment. So yeah, I think it's better to wait a little bit, mostly in my work, because I speak a lot. So in this kind of works, if you work with computers all the time and with your mouth shut, it's totally fine. You could maybe come back to work after 2 weeks or after a month. But for works in which you speak a lot, and also my saliva goes down a little bit sometimes, so it's better to wait. So I don't know if I will come back after 1 month post-op, or if they will extend a little bit, but I think it's gonna be 4 or 5 weeks of sickness absence. But I will let you know in the next video. And as I was telling you, in the next video, I also am going to just tell you all these questions and the replies I got, because maybe it can give you some more light, shed some light onto your doubts and things like that. So, and I thought to include it in this video, it would be so long. So we will have a bonus track with this information like very soon. Well, see you in the next video, and of course you can reach me in Maika Goodstone, the Instagram, Your Surgery, if I'm not mistaken. And any question or anything you may want to know, you know where to reach me. Good luck and patience, because this is very important, because you think that you're gonna arrive to the surgery and that's it. The end. No, I'm gonna have 6 months of orthodontic treatment after this, of Invisalign, and then the whitening treatment for my teeth, and that will be it. So it means that I will end this process in summer. So yes, patience is key in this, and you have all my encouragement, and see you in the next video.